I'm Ambassador Eric Goosby. I'm the President's Emergency Plan for AIDS Relief. I'm the director of that. The programs really cover hundreds of millions of people. When you look at it in terms of who we affect, both the person we're treating, but also their family members and the persons that they touch. Out of the 33 million people infected with HIV on the planet, we have 2.7 million new infections per year and about 2.6 million deaths per year from HIV still to this date. It disproportionately impacts Sub-Saharan Africa. About 70% of the 33 million people on the planet with HIV are in Sub-Saharan Africa. They make up about 90% of the deaths. They make up 100% of the pediatric cases on the planet as of 2009. So we've pretty much eliminated HIV transmission to children in the rest of the world, but Sub-Saharan Africa, all 55 countries, still are the 99.9% of the pediatric epidemic on the planet. We have also taken care of 3.8 million children who are orphaned. Their mother, father have died from HIV, and their family, extended family, are not willing because of stigma to care for them. So even in countries that are very, it takes a village to raise a child, sophisticated, where aunts, uncles, grandparents play a central role in rearing children, even in these countries, the stigma of HIV overwhelms that system of response, and we have found it necessary to intervene. You know, we have really gotten much smarter in doing what we do in the PEPFAR programs. Our ability to target our prevention efforts, to identify, enter, and retain people in care over the duration of their illness, which is their lifetime, have really enabled us to develop systems of care that allow us to know when you're in care and to, when you drop out of care for whatever reason, have systems that identify you and bring you back into care. That loss to follow-up strategy is a critical piece to a disease that's a chronic progressive disease, and as I say, you have for the rest of your life. Our moment in kind of history as one where we as a planet can start to look at the needs of the entire planet, the larger community of people who are burdened by diseases that their countries, governments, do not have the resources to respond to. HIV is a terrific example of that. A disease that is uniformly fatal, but its treatment requires a lot of money. Just as the Global Health Initiative that President Obama has put forward looks to an integrative exercise for U.S. government programs, we also realize that the synergies and efficiencies that we've identified in this exercise internally are only going to be amplified by now trying to partner and cooperate with other bilaterals and other multilateral activity in the same countries in which we're working. We want to aggressively work to partner with our European colleagues in developing targets within the countries that we both agree on, with our partner countries, dialogue around their strategic thinking, what their national plans have prioritized, and take the step into really working cooperatively with both partner country, other bilaterals, other multilaterals, to find and secure all the synergies and efficiencies that are to be had out there, so we basically save more money to put back into program to save more lives.